The ECOWAS Commission, in partnership with the Gambia's Drug Law Enforcement Agency DLEAG, has launched the 5th edition of the West Africa Epidemiology Network on Drug Use WENDU report. The document presents comprehensive data on drug use trends, emerging challenges and responses across ECOWAS member states and Mauritania, providing an evidence-based foundation for shaping policies on both drug demand and supply reduction. The latest edition focuses on treatment demand and access to services for individuals with substance use disorders, SUDs. While acknowledging progress in expanding treatment options, the report highlights persistent barriers such as limited qualified personnel, weak infrastructure, inadequate funding, poor information systems, low public awareness, and governance challenges in mental health care. These issues, it notes, continue to hinder access to effective treatment services for both providers and patients. Representing the Minister of Interior at the launch, Deputy Permanent Secretary Abraham Mendy expressed appreciation for the Gambia being chosen to host the event, describing it as a recognition of the country's commitment to regional cooperation in combating drug trafficking and transnational organized crime. Mendy also thanked the ECOWAS Commission for its support in establishing the Gambia's first ever specialized drug rehabilitation center, which he described as a milestone in the country's efforts to provide comprehensive care for individuals affected by substance abuse.
The government of the Gambia has always committed itself to investing in young people in all spheres of life, particularly in education and health. Equally important to this government is the need to enhance youth resilience in the face of a dynamic and challenging world. Therefore, for us as a government, the launching of this WENDU 2024 report represents a critical milestone in our collective efforts to provide evidence-based approach to addressing the menace posed by substance use disorder, especially among young people who are the cream of our society.
Speaking at the event, the ECOWAS Commission's Director of Humanitarian and Social Affairs underscored the critical role of reliable and up-to-date data in shaping effective policies and evidence-based interventions. She encouraged policymakers and development partners to use the WENDU report's findings and recommendations as a framework for guiding drug prevention and control efforts across West Africa. She further urged stakeholders to align their activities with the report's policy briefs and to identify priority areas within the region that require support, either through existing programs or new collaborative initiatives. The director reaffirmed the ECOWAS Commission's strong commitment to working with member states and partners to significantly curb drug abuse, illicit trafficking, and related transnational crimes across the sub-region.
The WENDU reports reportedly identify that there is a regional treatment gap. To address this challenge, the ECOWAS Commission has invested heavily in capacity building, training more than 200 professionals across 10 member states. If you read the report, you will see what cannabis is doing, amphetamine-type stimulants, local drugs that are being produced, and of course, ravaging on our youthful population. So this is an important aspect of the work we do at the Commission. We've done universal treatment curriculum training, universal prevention training for member states. The Commission has financed the renovation and equipping of 10 treatment and rehabilitation centers in our member states, representing an investment of $1 million.
Demba Cisse, Director General of the Drug Law Enforcement Agency, the Gambia, stated that since the inception of the WENDU project in 2014, DLEAG has been an active participant in its programs and initiatives. He noted that this collaboration has significantly strengthened the Gambia's strategic response to the drug problem both nationally and within the sub-region, particularly through the promotion of a balanced and integrated approach combining supply suppression with demand reduction. CISA described the launch of the 2024 WENDU report as a testament to the shared values and collective commitment towards building safer, more secure and healthier communities across West Africa. He further emphasized that the completion of the Gambia's first drug rehabilitation facility will be a game changer in the country's efforts to support individuals recovering from substance abuse.
As part of our alternative to incarceration initiatives, the center will enable us to provide support services for first-time offenders as well as implement community-oriented programs for drug offenders as a whole. With a slight shift in our drug prevention regime, we hope to project this center as a center for drug-dependent persons so that we can see for the first time, and for the sake of emphasis, to see these young people as victims instead of perpetrators.
The WENDU report remains a vital tool for understanding the evolving dynamics of drug use in the region. Its data-driven insights aim to support effective prevention strategies, enhance treatment services, and curb the circulation of illicit drugs. The 2024 launch marks another major step in the ongoing regional fight against drug abuse and trafficking in West Africa. Reporting for Kerfatu, I am Makutumani.